Hi, welcome everyone, and thank you for joining us today. This is our fourth open forum Q&A webinar, part of a series ARVC is hosting every Monday and Thursday. A chance for you to get your questions answered by your panel of industry experts. I'm David Basler, Vice President of Membership and Marketing for ARVC, and again, want to welcome you today. As participants hop online, I want to just start by reminding everyone that we are updating our information hub on a regular basis, multiple times a day, with new resources and up-to-the-minute news that you can download and listen to our previous webinars, download resources, forms, all sorts of things that will help you through this coronavirus crisis, and that can all be found at arvc.org/coronavirus. One other update that I've said on all of these webinars is we obviously aren't going to get to every question today, but we are working with our panelists and getting answers to those unanswered questions and posting them online on the information hub. There's basically a PDF document of all of the questions with answers in red under each one, posted under each webinar from when the questions came up. So check back if your question doesn't get answered. That's where you'll find the answer. And if for some reason you don't find the answer there, feel free to email us at membership@arvc.org. Before I introduce everyone on today's expert panel, I'm going to once again kick it over to Jacqueline Gloria on our team for some quick instructions on how to submit questions. Jack?
Hey y'all, thanks for joining us. As we go through today's call, if you have a question, please use the Q&A button at the bottom center of your Zoom window. If you see a topic that somebody else has already entered a question on and it's something you're also interested in, you can hit the like or the thumbs up icon to help float that question to the top of the list. The chat and the raise hands features have been intentionally disabled. David?
All right, thanks, Jack. So with those out of the way, I'd like to do some quick introductions of our panelists. We have some changes today. So Jeff Sims, who's normally on as our resident advocacy expert, will likely not be joining the panel today because he's working closely with Virginia's Campground Owners Association this morning. If there are any advocacy related questions, we'll get those answered as quickly as possible, like I mentioned earlier, after the webinar, and then you can also email those to advocacy@arvc.org. That email goes straight to Jeff. So on the panel today, our business and finance expert, Paul Bosley, is back, and Paul is the founder of Business Finance Depot, a company he established in 2006, and he regularly volunteers as a counselor with the SBA, Small Business Administration. So he's here to answer all of your SBA loan questions. Our emergency planning expert again today is Patrick Hardy. Patrick's CEO of Hytropy.com, leading disaster management company in the RV and campground industry, and he's also a certified emergency manager and certified risk manager. On the panel today, I don't see Chris Hipple has joined us yet, but we do have Irene Jones. She is a 25-year veteran of our industry, works for Marshall and Sterling. Chris, if he joins us, is also a 25-year veteran and works for Leavitt Recreation and Hospitality Insurance. Covering marketing today, we have Brian Searl and Mark Koep back with us. Brian is the CEO of Insider Perks, full-service digital agency and ARVC Supplier Council member, providing best-in-class marketing services for our industry. And Mark is a virtual entrepreneur traveling the country with his family in their RV, and is the founder and CEO of CampgroundViews.com. Our legal expert today is Christine Taylor. She's back. She is an attorney with Towne, Ryan and Partners in Albany, New York, specializing in labor and employment law. And she also has a unique perspective on our industry, having grown up at her family's campgrounds. And new with us today is Jenna Smith. Jenna has a master's in social work and is a practicing mental health professional based here in Denver, Colorado. Besides being an expert in her field, Jenna is a great personal friend of mine, so I'm happy to have Jenna agreed to join us today to help answer all your mental health questions. Jenna's specialty is dealing with anxiety and depression, two things a lot of people are dealing with right now as this crisis continues. So I'd like to start us off there, actually, and then we'll jump into your questions on other topics. But knowing that we have a mental health professional with us today, feel free to ask any of those types of questions as well. So Jenna, these are obviously very stressful times for all of us, campground owners, employees, everyone. What are a few, in your opinion, what are a few simple things that you recommend we start doing today to help improve our overall mental health and the mental health of people around us?
So, hi everyone. It's a good question. There is obviously a lot going on. I think first and foremost, it's really important that you guys look at a work-life balance. So kind of hard to do, excuse me, kind of hard to do when we're all, working out of our homes and our schedule is kind of thrown off. But part of that is, setting a time for when you switch off, whether that's looking at business emails or talking to customers. I think technology can really blur boundaries between work and home, and it kind of makes us feel like we're always on. So that can look different for different people, right? Being on the phone, on your computer, iPad, etc. And then also reminding yourself you have to really take breaks throughout the day, whatever that looks like. So taking a meal break, getting outside for a short walk. And really what I'm talking about right now are, self-care. And I think self-care kind of goes to the wayside when we're worried about, finances, when we're worried about how are we going to pay the bills, how are we going to get food on the table. And obviously everyone has different worries right now. But self-care, I would say, is so important for everyone, every industry. It's kind of across the board. And then it's also important that we're not working all the time. So you take an afternoon off, you make sure that we have a weekend, or if you can't take the weekend off, if that's the time that you are working, then you designate a Monday as your day off. And then also thinking about, are there ways to delegate? Are there ways for you to turn down some things, to say no, and kind of prioritize tasks? And then another thing is just really planning out your day and being intentional. Even if you're just going to the living room, to work, or downstairs in the basement or what have you, get dressed, make your bed, brush your teeth, do the things that you would normally do, even though obviously everything looks different. So those are kind of some things I was thinking about. I think right now for everyone, that work-life balance is important. So those were some initial thoughts that I had.
Excellent. And those are some good broad pieces of advice. You gave me earlier some resources that I think will dive a little deeper into some tips as well, some more specific tip lists, if you will, that will get posted on our website as well at that arvic.org/coronavirus. So after the webinar, check back and we'll have some of those resources up. Jenna, I want to follow up with something that I've personally been reading about recently, a lot about reflective listening, and how this technique of listening and then repeating what the person says to us can help us in many ways kind of validate the concerns that they have. And so I'm kind of thinking of this as a scenario of campground owner with employees who are coming to them with concerns, and talk to us a little bit about the importance of how that strategy of reflective listening can help us better serve not only our customers, our employees, our family members, everybody who's coming to us on a regular basis.
So reflective listening is really powerful. Reflective listening is basically where someone says something to you and then you say, what I hear you saying is this, and you kind of are almost repeating back what they said. Now, a lot of times if you have an employee coming to you right now, especially, there's heightened stress. A lot of people are looking really to be heard, and they're looking for validation. All of us need validation in different ways. And so if you have an employee coming to you with a concern, it's really important that you're not thinking about the next thing you're going to say, that you really stop and just show them that you're listening, obviously eye contact. And I know we have the 6-foot rule right now, so it's a little harder to show some of these things, but the more that you can listen and kind of pause and take a breath and then really let the other person just know that you heard what they said, whether that's, that makes a lot of sense. I hear what you're saying. Also just giving them, you sound frustrated right now. That must be really hard. So also showing compassion. But yes, the reflective listening is very powerful. If you have someone coming to you under distress or they have a question and they're upset, it's really important that you let them know you heard what they said. And then it also might be something you can't answer right then and there, and that's okay. Saying, you know what, that's a great question. Thank you so much. I need to get some more information and then I'll get back to you. But really letting your employee know that you hear them, that you understand them, even if you don't agree with them, that's okay. That obviously is going to happen, but they just need to be heard. Their voices need to be heard. They need to be validated, and knowing that their opinion is okay, that their opinion matters.
And that, I would say, goes for customers too, right? Anybody, really.
I'm sorry, say that again, David.
Sorry, I was saying that would go for anybody, really, right? Customers as
Absolutely.
well as employees, right?
Everything, customers, employees, colleagues, everyone. Yes, yes.
Yeah.
I think a lot of
Awesome.
times people have so much that they want to say. And so when someone's talking to you, you can almost see them ready to jump onto the next topic. And it's so important that we're just present with whoever we're talking to, that we're with them, we're listening, and then you move on.
All right. Thanks, Jenna. I'm going to jump to legal as we have more mental health questions. We'll come back to you. Christine, this next question is for you. This is coming specifically from a campground in Pennsylvania that says that they have 500 sites. But I'm really not sure that is completely relevant because I think this will affect everybody regardless of size of campground or where they are. The question is, when we open, when we finally are able to open, what sort of liability are we assuming in regards to this COVID-19 virus? If someone gets sick while they're at the camp, will the camper and courts assume that the campground has some liability in terms of their health care? And what can campgrounds do to avoid that if possible?
So this is going to be a very, very interesting one, and we're not exactly sure how it'll play out. There are two considerations. One is, as we've discussed previously, it's going to be very hard with the incubation period for this particular virus to prove where somebody actually picked it up from. So if you had a known case, your scenario will be different. So if you knew someone had the virus and you didn't do all the steps you needed to do, and then someone else got the virus from being there, be it employee or guest, I think you would have some legal liability there. But if you hadn't had a known case, and if you had done all of those cleaning things that Patrick and everyone else has been suggesting, then I think that would help lessen your liability. this is where what we talked about previously with documentation and proof is important. You want to be able to prove that you did those things to lessen your liability. You want to prove that you took all those steps. And if you got any directives from your state or county health department, you want to make sure you follow those to a T and can prove that you followed those to a T. That'll help lessen any kind of liability that might come up. The one thing I'd have to say is, although you can have all those releases and waivers that we've been getting a lot of questions about, as with anything, nothing actually protects you from getting sued. It just really helps your defense. So what you're doing is you're building up a defense for the worst case scenario, but you're hoping for the best case scenario that no one actually sues you.
I want to ask a follow-up to that, Christine, because we've gotten a lot of questions both at the webinar and offline about how to word that type of letter or that type of form. Do you have any advice on that front, or is it kind of all over the board based on where they are?
It is kind of all over the board based on where you are. I know that you hate to hear that. So I would generally say that for any kind of document you're going to put out, you have to first look to what your state requires. I can say generally that with any kind of release or form or whatever, best practices are that you make sure they know what they're signing, that they understand what they're signing, that they have the time to read what they're signing, and that if they request a copy, you give one to them. That's general for waivers and releases to make sure, because if those things aren't met, then it'll be hard pressed to give any weight to that waiver. But specific states do have specific rules. I can't remember which state, but one state in particular, wants capitalized in bold language in such a waiver for it to be worth anything. So you really do need to check in with somebody in your own state to make sure you are designing a document that has any weight. At the very least, if you have any document and you give them the time to read it, etc., it'll prove some kind of assumption of the risk to show that you are assuming a risk, and helps you, again, prove a defense later on that that person knew what they were getting into when they came to your campground. So, your liability should be less because they assumed that risk and came anyway.
And is the most likely place to find that information probably the Secretary of State's office on their website, more than likely?
So that's kind of a hard one. You could do a Google search. It's usually embedded in statutes in your state. So for us, it's under this kind of waiver and recreation statute in New York. So it's definitely usually contained within the law. I'm not sure the Secretary of State for every state would have that kind of information online, but I can say that you usually can find it with a targeted Google search, looking for your specific state law.
Okay. All right, I'm going to jump to Paul Bosley in our SBA topic. We have a question here about how people, Paul, are you on with us? You are, correct?
Yeah, I just had to unmute myself.
Awesome.
Go ahead.
All right, just want to make sure. So the question is around how campgrounds are accounting for work campers in terms of payroll costs when it comes to these PPP loans. There are a lot of campgrounds out there who, for better or for worse, have been paying work campers through sites instead of through cash, through payroll in some way. But whether or not they're doing that or whether they're paying through payroll, let's cover both on this question. How would you recommend that that they approach that when applying for one of these PPP loans?
Well, the information that I received from a webinar, which was from a bank, and the disclaimer I'll give you is that the information has changed significantly already this week, and the final information has not been released yet. So again, the information that I'm about to give you may change again. But the understanding that we have at this point is you take the average payroll calculation, basically for last year, which would include payroll costs and your insurance and 1099s. And that would be the the number that you put in the application form, which we have it's a sample copy that the Treasury Department put on their website. And there's just one number that you put in and it says payroll. So the number that you put in is going to have to be, there's going to be attachments that you're going to also have to submit beyond the application form. And the attachments include, payroll forms like 940, 941, I guess K1s is right now, I'm assuming they're going to, any type of legal form 1099 that you normally would submit as part of your tax returns is what they're going to accept. And the insurance can be, payroll costs are included, insurance is included, but that's what I understand at this point. It's limited to the documents that you would normally submit as part of your tax return.
So I'm going to bring Christine in here as well on this question because, like I mentioned, there are campgrounds out there who don't pay their work campers through some sort of payroll. They pay them with sites. How is that going to affect this particular situation?
Honestly, it's likely going to hurt you. Unfortunately, I wish I had better news. Generally, you should be running them through your payroll anyway for workers' comp considerations, because if they got hurt and you weren't running them through workers' comp and you got sued for that, that would already be a problem. So that's why best practices are to always run people through your payroll, because you're going to be able to prove the value of that campsite, I think, effectively. I think you will have a very hard time. I especially think you'll have a hard time on the loan forgiveness end, proving that that is in fact a payroll cost, because the law itself prescribes the specific documents to prove payroll costs for loan forgiveness. And I think you will have a very hard time looping that under there. Again, you can talk to the lender you have currently to see if they have some way to calculate that, but I unfortunately think chances are very small that you'll be able to calculate that as part of your average payroll costs.
Okay. We had Christine, while I've got you on the mic, we have another legal question here. If someone has COVID-19 at the park, should the park communicate this to campers and staff legally? And is there a HIPAA issue with doing that?
So this is a little bit of a finesse standpoint. From the very start, this is where you would go to your local health department first. They're promulgating directives of what to do if someone has COVID-19. So that would be a good first start, because that's what they're asking you to do. Now, generally, you're not supposed to give details. So if someone has COVID-19 at the park, you shouldn't necessarily identify them. You shouldn't say, oh, well, Sally tested with COVID-19, but you can say that somebody at the park has tested with COVID-19, and likely based on those health department directives, they're going to make you alert so many people and track so many people down. So you can say that there was somebody with that virus, but I would be very careful about targeting who it was. That's your HIPAA concern, because you're not supposed to give medical information about other people, but you are going to still have a requirement in which you have to disclose that somebody did have that virus on your property. So that's kind of where the careful consideration is.
Okay. Back to you, Paul. Some other PPP questions and follow-up here. This gentleman is asking, does the PPP loan cover new hires? It's actually kind of a multi-stage question. Does the PPP cover new hires or just returning employees? That's the first part. And then the example, I guess, or second part is, can I hire and cover a new person / put myself on payroll and have it be covered by these PPP loans?
Well, the information that I have that I just shared is you take the average. If you were open last year, you take the average for last year. And information that I previously had that I shared, I think in our last webinar, is that if you weren't open last year, you would take the average for the months of January and February. Either way, the application has a cell for average monthly payroll. And then it just.
And it includes everything, besides 1099s, K1s, everything that's included in payroll, correct?
That's my understanding at this point. That's correct.
Okay.
Now with new hires, I mean, if you think about the forgiveness part of this, it's an 8-week period from the time that the loan funds. So let's just say, for conversation's sake, the loan is, you apply for the loan, it's supposed to turn over relatively quick. So let's just say it funds in April. So sometime from the date that it funds in April until 8 weeks out, whatever you pay people, and it could be, this is the kind of the second part of your question. So let's just say you hired somebody new, whatever you pay people is going to be quantified, and then they're going to compare how much payroll that you paid compared to what you paid in the average month. And they're going to adjust the amount that you get back. It sounds like it's some kind of a percentage. And then you add to that your operating costs, your rent and your utilities and your interest on your mortgage if you're not renting, which probably very few park owners rent. So, and that's the amount that you submit to your same lender with the backup documentation that I mentioned, the payroll forms and the legal information that you submit. So Christine's advice is actually very good advice. If you're going to hire somebody, put them on payroll so that you can get that amount forgiven. And then what changed also since the last webinar is the repayment term was 10 years and now it's 2 years. And the interest rate was 4% and now it's 0.5%. And no one that gets one of these loans will have to make a payment for 6 months, which gives you plenty of time to apply for the deferment.
And is there a limit to the amount, the dollar amount that can be funded? And if so, what's that limit? Remind everybody.
10 million.
Okay.
I'd just like to add one caution really quickly.
Sure, go ahead.
In addition to the terms and interest rate changing, there's now been a certification added that you have to certify that you're using 75% of the loan for payroll costs, when before they hadn't put that requirement. They only want you to now use 25% for those other costs. So that rent, interest, et cetera, that Paul was talking about, they now are saying that making the application that's been circulating is saying that they are likely only going to forgive the part. They want you to use it mostly for payroll costs. So why this is a concern is we think that the SBA is kind of freaking out that they're not going to have enough money to fund everybody. So since the intent of this particular bill was for payroll costs, they're now having people certify that they're going to use the majority of it for payroll costs. So again, that's probably a consideration you want to keep in mind when deciding which loan you're going to apply for, because if your payroll costs are very low, this might not cover the expenses that are coming up for you.
Can I add a question onto there?
Sure, go ahead.
David,
go ahead, Mark.
let me add a question, because one of the things I'm seeing is a lot of people are starting to try to get creative with this and, say, oh, well, I used to have these really high paid employees and I can replace them with 2 lower paid employees, or, is there any advice to folks who are looking to game the system a little bit?
Don't. They are truly be as honest and straightforward as possible. Be open and honest with your lender. This is why using a lender you've used before might be helpful. They've also come down in their guidance from the Department of Treasury that if you make false certifications or use the loan for things that you're not supposed to, or say that you used it for one thing and you didn't, or falsified records or any kind of dishonesty, that they might come after you with criminal charges. And you don't want to take something that's supposed to help you and turn it into criminal charges. So be very honest and very careful. As I'm sure has probably been discussed, it might be very hard to hire back the same people you fired to get your 100% numbers. So that's an honest way to do to have that. Like if you don't have the exact same employees, that's not your fault. That's okay. But if you're trying to fire people to lessen your payroll and game the system, I'd be very, 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 very hesitant to do so, because you might see repercussions, whether in forgiveness or something else down the line. And you want to have done everything above the board so you can take the full benefit of this program without any repercussions.
There's an ethical side of that as well, obviously. Right? I mean, we're talking about a program here that is set up to help businesses that are really ailing. So I mean, based on that alone, ethically, I would think you wouldn't want to game the system.
Agree.
Yeah. Irene, did you have a follow-up?
Christine, I wondered if you could clarify with that 75% for payroll cost. Is that with or without health insurance? Because I'm thinking that's a large figure in there. Do you know?
So actually, that is because of the way they define payroll costs, group health insurance benefits, including insurance premiums, are considered part of payroll costs. So that's beneficial. The not part of that 75%, those are those other interest payments on other debt obligations, mortgage interest payments, rent payments, utility payments. Those are all of the other 25% things that you can use it for. That's how come when they made the original calculation, they made it 2.5, because their intent was you get average payroll for 2 months of payroll and then an extra 0.5 for those other things. So it's always been their intent that the majority of it was supposed to be payroll. They're just making it making it more clear as they want people to certify that they're using it mostly for payroll now.
Okay. And another follow-up question to all this for either you, Paul, or Christine, just to confirm really that if a work camper or any other employee really is not starting until the end of May, let's say, can they still apply is the question. And because of the average, the answer would be yes. Is that right?
Well, yeah, I think they're two different things. You've got when you're calculating the average, you're looking in the past. And when you're submitting the forgiveness, you're just submitting your payroll costs in the next 8 weeks after you close. And I don't think anybody's going to look to see if the names are the same names. They're just trying to make sure that you're using the money for payroll.
Okay. All right, I'm going to jump back to mental health real quick. We have a question here for you, Jenna. And the question is around resources related to mental health that campground owners can communicate to their employees and guests. Just want to kind of reiterate, I think, the resources that we're going to post on the website cover that, or are there other resources that we can get to cover that question?
So, I mean, I would say the resources that you're going to post definitely will be a good start. I guess it depends on the level of resources that they're looking for. I think it's always good to kind of have tip sheets posted around and available on a website just for gentle reminders of, one of the tip sheets that David's going to be posting is anxiety reduction strategies. So it's just, I think tip sheets are really helpful. They're simple. We all can use them. Now, if they're concerned about an employee, maybe needing therapy or possibly suicidal and those kinds of things, there's obviously hotlines that they can call. And then a lot of therapists now are doing what we call telehealth, where you don't have to go anywhere. You call in and you can do therapy just, from your home. And I know a lot of people are offering pro bono work and sliding scales, reduced fees. So I guess it just kind of depends on the level of support they're looking for. But I'm happy to keep, giving you guys resources to look at, so they have them available.
Can I jump in as well, David, for a second?
Yeah, go ahead.
Yeah, one of the things that we've been using is the American Association for Marriage and Family Therapy actually has a page that is specifically dedicated to mental health during COVID-19. So there are sections in here and resources regarding telehealth for those people who are actively doing CBT, for people who are also, it sort of talks to you, for those of you who are actually operators, it also gives you guidelines regarding people who are providing services to employees as well as to EAP programs. There are, they also have guidance in here. Matter of fact, I'm going to scroll down to the bottom here. They actually have resources for parenting and children about how to talk to children about the coronavirus, dealing with disaster shock. And I actually agree with, some of the things that have already been said, which is posting up things are great. It also has resources here for dealing with the elderly, for those of you who are healthcare providers. I know of a couple of the RV parks were asking me and talking to me about guidance regarding first responders who are actually staying at their parks, particularly in some of the more rural counties where now there's beginning to be some more surveillance in regards to COVID-19, and people are actually staying in parks for that. And then also there are some really, really good stuff, things that we've actually been using regards to stress and coping. So at the very bottom of the page, and I'm happy to share with you the URL, David, I'll email it to you so you can share it with everybody. But that page also has some terrific resources on how to cope specifically with isolation and people who are in places where they normally are very social and in fact now have to be quarantined and very isolated.
That's great.
Okay, great.
That's a great organization. And then there's also SAMHSA, the Substance Abuse and Mental Health Services Administration. They've also come out. I mean, I think obviously a lot of organizations are going to be hopefully coming out with more and more helpful, articles for the elderly, for parents, how to deal with kids, all of those things.
If you guys will send me those links, we'll get those posted right away.
Sure.
On the website. Patrick, while I've got you on the mic, I've got a series of questions here regarding your area of expertise. In terms of, they're looking for guidance on social distancing specifically. Do members of the same family need to distance in their accommodation or common areas? For instance, dad and kids go fishing. Do they have to just be separated while they're doing that? A family at their own campfire, do they have to be separated in doing that kind of thing?
No. CDC is clear on this. That is not something that you have to do. But one of the things that they do say is that if it's people who live together who are non-related, that is a number that they talk about and worry about, which is the number of people who are there who, especially, people were asking questions about, well, what happens if there's people who are groups of like 10 people or more and they're not related? Then that's obviously very problematic. The one thing that they have warned properties against, and this is also occurring a lot of, I was doing a webinar with the hotel industry, this is an issue as well, which is you have people who are congregating in an area, and because people, they'll see a group of folks who are maybe 6, 7, 8, 9, 10 plus people, and let's say they're all in the same family. Sometimes what happens is that other people will see that and think, oh, okay, so I guess we're allowed to meet in groups now. I guess that's okay, not realizing that that is a family. So that becomes an issue with having enforcement of the social distancing orders. So that's one of the things that and in the industry, and one of the things that they have given guidance on is they've said, look, if that's the case, you still need to prevent people from meeting from groups of 6 or more, because that becomes a management problem. That becomes an issue for, because what happens is that people are going to see that, and then they're going to ask you, they're going to say, well, wait a minute, I saw other people last night. I saw 10 people or more around a campfire. I saw this and this. And then that's something you're going to have to explain. So one of the things that we advise campgrounds to do is to say to families, listen, if you're going to hang out, you need to do that in your rigs. If you're going to go out with 1 or 2 of you, that's okay. But if it starts to get to be where we're seeing large congregations of people, that is a problem for me as an operator. And that's something I therefore have to generally prohibit. So that's one of the things I know it's sort of an odd distinction, but it's one of the things that you probably have to do. Otherwise it becomes an enforcement issue.
Okay, great. Christine, do we still have you on the line?
Yep, this will be my last one.
Oh, go ahead, Christine.
Excellent. Christine, because I know you're getting ready to jump off. I've got two real quick questions here, if possible. The first one is, one of our full-time residents is getting off of one of the cruise ships in Florida. Should we require him to have doctor's note stating his current state regarding COVID-19 before allowing him back into the park?
I mean, so if he's a full-time resident, like he lives at your park, that will be a little different. You're allowed to promulgate policies. I'd be careful with the doctor's note policy. Again, that's a little rough, but you can ask them questions. You can ask them if they have any symptoms, and you can require people to quarantine if they come off one of those cruise ships. But if you are going to do that for that specific guest, you're gonna have to treat any guest that's like that the same. As we've said before, you're gonna wanna have put together a written policy before then, because you wanna make sure that's evenly enforced. I can understand that concern. So you definitely are allowed to ask those questions and have requirements, but it can't just be for that one particular person, because you don't want to run into discrimination issues. So broad thoughts there.
All right. And then the next question real quick is, if an owner owns more than one park under separate legal entities, can they apply for the PPP loan under each entity? That question for you, maybe, and for Paul there.
So what I've seen so far is that I'd say yes, generally. You are going to have to report on each application that you own and have an ownership interest in another company. They're requiring people to do that. They will consider it the same company based on an affiliation test. So they might consider them affiliated, but since for that, I imagine you probably still have less than 500 employees, so you're probably still okay. But generally, if there's a concentrated control for both of those businesses from one person, they consider those affiliated. So I guess the answer is yes, you can likely apply under both entities, but you will probably have to speak with your lender. Paul, do you have anything different to say?
Yeah, while we've been listening, I've been filling out the application form because I've got the sample. And I want to answer this question, plus I want to circle back to one of the earlier questions. One of the questions on the application form is the business or any owner or an owner of another business or have common management with any other business? If yes, attach the listing of all affiliates and describe the relationship as addendum A. So what Christine said is true based on this. What's going to happen is if you have multiple campgrounds and they're all separate, you're going to list them all on each application. The only difference is, you know, Campground A is going to list Campground B, C, and D as affiliates, and Campground B is going to list Campground A, C, and D as affiliates. So this way, when you send them in, they're going to see the list of affiliates that you own on each application.
And that may or may not affect the decision.
I don't think it has anything to do with it. You know, they're all different entities. I just think they're just trying to make sure that if you own an affiliate, you just list it. That's all.
I think that it's more of a concern for people who are pushing up against the 500 employee threshold, because if you own all of these, then they might be less likely to consider you a small business if your employees push you up over the 500. The thing that's different for campgrounds anyway is there's a carved out exception for people in the Sector 72 sphere, which is food and accommodations. So they are allowing certain different requirements than normal for affiliation in those. So I really don't think a campground is likely to run into an issue in that regard. With that, I need to step out, but as per usual, email your questions in and I'll answer them.
Great. Christine, thank you so much for joining us. Appreciate
Thanks,
it.
Christine.
Thanks, Christine. David, this is Mark. I wanted to jump back to what Patrick was talking about in regard to the appearance of social distancing. This was an article sent to me by Ben over at Woodall's Campground Management, and it states that a New York County has closed parks through the beginning of July. And the specific quote from the county commissioner or executive of the county is, "Campgrounds are communal sites where people congregate. It's not safe. I'm trying to keep people safe. Those who use them as seasonal residents should stay where they are currently at," said Pacenti. This is something, and I don't have the answer to this, and I know ARVC doesn't have the answer to this yet, but this is actually a gigantic risk to our industry where we have these local and state officials who are implying their own personal opinions about what camping is and saying, oh, because you're camping, it's communal, you're going to get the disease and you're going to spread it. This is a big problem, and I just want to bring it up in this call because it's something that we as an industry are going to be tackling as we come out of this 30 days that's been imposed on the federal level, on the state level. I mean, frankly, if I'm a campground owner in this state, I'm looking at the state constitution, and I'm hiring an attorney right now because July 1st seems a little bit insane.
Well, and to just tack on to that, I know that is something that, as they pop up, Jeff Sims on our team has been working directly, either depending on what the state is, either directly with the county official himself or through the state association. In that particular instance, it would be through Coney or whatever it might be, to tackle those specific instances as they pop up and educate those officials as to why that necessarily is not the right way to look at it. So right now it's a county by county effort, basically, and it's Herculean by Jeff Sims, by the way.
Right, and I agree with that being Herculean. And so my only worry is that, does ARVC, do you have the resources to tackle this, or does this something that becomes more of an industry-wide? Is there a way to really kind of pull some resources behind this? Because, I mean, you might fix this New York instance, but then we have 4 more counties pop up that do the same thing, and now all of a sudden, I mean, you're just playing whack-a-mole with this. I mean, what's ARVC's opinion on where this ends and where we should go as an industry?
One of the ways that is extremely valuable in situations like this is those officials hearing directly from their constituents. It's one thing for them to hear, and I think if Jeff were on the call right now, he would say the same thing. It's one thing for, county official in New York to hear from ARVC or even from the state association. It's another thing to hear from someone who actually votes in that county and has a business in that county who's being affected by that. So a grassroots effort, as we've seen in issues in the past that have popped up, is extremely successful in situations like this. ARVC has that, we've instituted that grassroots campaign in a lot of states, and that's something that if you are interested in doing, I would suggest reaching out to either to us or to your state association to start talking about what type of grassroots effort is available in our state. And frankly, I think you can take that upon yourselves as campground owners as well to have those communications on your own too. But the purpose, obviously, of a grassroots campaign is to have a consistent message being hit in those government offices in vast numbers. We have had on the campaign that we've put out there a couple of weeks ago, we've had thousands of letters go out to government officials around the country. And in many cases, it's making a big difference. We've had a lot of states and local governments switch their course because of that type of campaign. So it's a question I'll also pose to Jeff Sims as well too, because I think he might have some more insight that I can't share necessarily.
Thank you.
Yeah, no problem. So Patrick, I'm going to jump back to you here. I've got a question about when we finally do open back up. What are your recommendations for how we judge when it's safe to reopen things like playgrounds, restrooms, and other amenities that have been potentially closed?
Yeah, it's a good question, and the answer is you're going to need to look very closely at the county's public health guidance. One of the things in California, for example, I was meeting with a number of county executives in Southern California because this is obviously a big deal because of the ubiquitous great weather but very hot that they get in Southern California, and people saying, well, you know, what happens when we want to reopen the pools? What happens when we want to do this? And the water parks were asking about this as well. And the answer is that there's going to be some directed guidance about when you reopen. There's going to be some, and this is just a guess. I mean, we don't really know until we start to get more of a national consensus on it. But in general, what they're going to say is that they're going to ask and say, well, I mean, you can reopen the pool, but there's probably going to be a very strict limit to the number of people allowed in the pool, and they're also probably going to give some guidance as far as concentration of people. So it may be that you're going to have to space out how close people are together. You know, like I know that, you know, there's a certain number of chairs you're going to be allowed to put out. I know it sounds weird, but they're going to do that as a control to the number of families that can be in the pool area and the number of people who can be in the pool area at any one time. A couple of people were asking questions this last weekend about, you know, so what about having to re-sanitize the pool and this and that? Those are things that we're not going to know until the CDC gives some direct guidance. But I will tell you this, is that your county health department will be very clear on what their expectations are, and we will know right away because it's one of those things it's one of those directives that's become very unpopular to say, well, we have to close the playground, unless you're an insurance company, of course, in which case you're ecstatic that they've had to close the pools and things. But other than that, they're trying to find ways to get those reopened and provide guidance for those. Playgrounds are going to be really complex because they're obviously touched by a lot of children. And I can tell you this for sure, I'm almost certain of this, that they are going to give you a disinfection schedule for those. I know that there was some talk with OSHA. I was talking to IHMM and the industrial hygiene people, and they were saying that it is very likely that they are going to say that, you know, you're going to have to disinfect it over a period of time. And it may not be year round. It may only be there certain periods of time. And it may also, this is my feeling, is that it may be that what public health will do is that they will say, you know, it's not going to be the case you have to disinfect year round. But when we give the directive that, okay, this is the time of year when you have to start doing it, they will give you a bandwidth of months, you know, where they say, well, between this month and this month, you're going to have to do this schedule. You're going to have to follow this schedule and do it, you know, and make sure that everything is safe. And then we may extend that. So that's right now, it's really speculative, but just I tell park owners to kind of be prepared that there's going to be some specific guidance provided by public health in that regard for sure.
Okay. This next question kind of, I think could be answered by you, Patrick. I think it could also be answered by our mental health and marketing experts as well. So I'll pose it to anyone who wants to jump in. Are we able to facilitate outdoor drive-in chapel services? Maybe a benefit for some for mental/emotional health, but are there negative consequences for facilitating or allowing that kind of gathering? Who wants to tackle that one?
From an emergency
Mark,
preparedness perspective, okay, Mark. Go ahead.
Yeah,
John.
let me
Go ahead, Mark.
jump on that from a marketing perspective. So religious services are becoming a hot button political issue right now in regard to, there's actually a case in Tampa where they went in and arrested a pastor because he had a church service. So I just want to comment from a marketing standpoint that this is a hot button issue. So wherever you go with this, recognize that on either side of it, you're going to get pushback, whether pro or con. So from a marketing standpoint, recognize that this is going to get people fired up either way. So that's what I'll say on the marketing side.
And I do want to clarify that this particular question was asking around an outdoor drive-up, almost like a drive-in movie type of scenario. So just keep that in mind as well.
Yeah, I'm going to say that maybe
different-
that might not be a terrible idea from a marketing standpoint, and just disagree here. Maybe I'm not saying I'm right, but just obviously if they're self-contained in their car, and the reason I'm saying this is I've read several articles about the increasing surge of people wanting to go to drive-in movie theaters again because they're self-contained in their cars and the movie theaters are closed. And so, I mean, there's an opportunity there, I think, as long as you're carefully managing it, because people are not congregating in a normal church fashion if they're contained within their cars.
Yeah, and I'll add on to that, Brian. I'm not saying that don't do it. I enjoy the opportunity to go to church. I'm just saying that recognize that whatever your choice is, you're going to get pushback either way. So then it becomes not only a business decision, but a personal belief and religious decision, which goes, basically, what are the three things you don't talk about at dinner? Politics, sex, and religion. Well, you just jumped into politics and religion into that conversation. So make the call, but also be willing to take the feedback and stand up for your decision.
Jenna, what's the potential benefit here when you're able to start reintroducing elements of normalcy back into the lives of campers, for instance?
I mean, I honestly love this idea. But it's all about how it's organized and rolled out, obviously. So many of us find comfort in obviously being in groups and being able to socialize, but obviously attending any kind of a religious service, event, church, synagogue, regardless of your religious affiliation. I think there's so much comfort that goes along with that. And then also it's part of people's, how they grew up. It's part of their structure. It's what they have done in their lives. People will go to church every Sunday. They'll go to synagogue every Saturday or Friday night. And so I think it's a great idea. I just think obviously, yes, it is a huge hot button right now. I think there are people that are still being very irresponsible and kind of ignoring the social distancing rules, recommendations, and which is creating an issue around it. But I see it as a huge benefit when people know that they can go, they can pray, they can kind of resume some sense of normalcy that they had before COVID-19, hit us. I think it could be really positive. I've also been seeing, and maybe this would be, not quite to the extent of doing an outdoor service in our cars, but that they're offering virtual services. I've seen a lot of that online, that churches are offering, virtual Sunday service, which I think would be kind of a nice gradual stepping stone before we get to the outdoor service. But I mean, I think it's a huge benefit, but I think it's really important that we're very careful about, people need to stay in their cars and being respectful of obviously the social distancing.
Virtual is a good option there, I think, because a lot of our campgrounds have chapels or some sort of service in a community building, but rather than doing that, if a drive-up option isn't available, having that service in a virtual way where people could stay in their RVs and still participate is, I think, a great idea.
Absolutely. I mean, I think And then it would also give people still the sense of going somewhere and participating in a service, even though they're still being safe and, you know, not putting themselves in harm's way or others.
Yeah. But so before we jump to the next question, I want to just stop for a second and remind everyone that some of the questions that are coming in today are questions that have popped up before in some way, shape, or form. So I want to again remind everyone that the webinars that we're doing are recorded and available on arvc.org/coronavirus, as well as any questions that didn't get answered. So we've got a lot of questions around the SBA loans, PPP and EIDL loan situation, and a lot of them have, you'll be able to find those answers on in either the recording or the written questions and answers that are posted there. And then another series of questions that have been coming in that can also be found there. Things like, how do we know if we're essential business in our state? Who tells us if we have to close? Those kinds of things. A lot of the answers can be found. We have a state-by-state specific tracker that Jeff Sims is updating regularly. And a lot of those answers can be found on that tracker. Kind of the second half to that question, who tells us if we have to close? A lot of that, as we hit on earlier in this webinar, is coming from the local level. Sometimes it's coming from the state. It just depends on where you are in the country. So keeping in regular contact with your local and state websites, executive orders that come out from government officials, and all of those things, those are all available on the website as well, arvc.org/coronavirus, under the heading of Advocacy. So I just wanted to let everybody know that. We have a question here regarding, it's kind of a risk management / insurance question. Do we have to go to the health department with just a suspected case, not confirmed, of a guest? And what if the guest says no, but we think they may have symptoms? And that may have a little bit of a legal tint to it as well, which we can follow up with Christine on. But our insurance experts, do you have any thoughts on that question?
I'd like to see what Patrick says about that as far as reporting requirements with public health.
Patrick?
Yeah, public health is very clear. If you have a suspected case, you need to contact them immediately. And the reason is because you're not a doctor. They don't expect people to be professional epidemiologists. They don't expect people to do anything like that. But what they do ask is that if and the reason is obvious, because they want to try to nib up this stuff in the bud. They don't want there to be a case where, where people thought it could have been, but they decide, I don't want to, I don't want to necessarily reach out. And the public health department, they have ways of very quietly coming out and getting an idea of, what's going on. There are procedures, and the reason why I can't be more specific, I know a couple people pinged me during this webinar, I can't be more specific about a lot of that, and the reason is because every county and every state has its own methodology for how they're going to do that. So in some states, they want you to call a phone number. In some places, you will call and then they will send someone out. In some cases, they will do inspections, things like that. They will ask you things, so they will actually do outreach to you. So it really just depends, but my general guidance on what we are telling parks is that if you have a suspected case, you should contact the public health department at the county level. Don't try to call the state. A couple of people said they tried to call the state and they couldn't reach anybody. The states are incredibly overwhelmed. And I know that some folks, that's what their normal status quo is, that they would call the state. But in this case, it's best to contact the counties and just say, I have a situation here. We could have a COVID positive response. How would you like me to handle this? And they will, and they actually have protocols in place that were promulgated. Every state has it. State Emergency Management has actually given direction to County Public Health, which was done through coordination with the CDC, which says, you know, if you have a suspected COVID-19 case, here's how I want you to handle it. So you don't have to worry about calling the county and the county's going to go, I have no idea what I want you to do. They're going to say, here's how we'll do it. We'll come out, we'll do an inspection, we'll do this, we'll do that. And just a quick, Chrissy was talking about earlier, they will also give you guidance on who you can and cannot tell about what's going on, you know, regarding if there's a COVID positive case. So they will say, okay, in these instances, you know, we would ask that you do tell people in the park, you don't tell people, you tell people this, and they'll really help you, you know, with the messaging. So which is really good, because about a week ago when we were having these webinars, as I was telling you guys, they can't give you really specifics on messaging. Now they can. They give you a lot of specific messages of who you can speak to, what you should tell them, and that helps to at least get the conversation going. So, but at least from an emergency management perspective, that's the guidance that I give every park.
Okay, that's good. Paul, this question is going to come back to you. This is an SBA question. If we're experiencing loss of business and loss of income, but could maybe survive with savings in retirement, should we pursue the loans or consider that others might need them more? Will there be limited ability for people to receive the loans if you know, something were to change in that scenario that they posed? Should they go ahead and just apply for the loan in your recommendation?
It sounds to me like an ethical question. I mean, from a legal perspective, they can. What they have to do is they have to certify that one of the, if you don't mind, what I'd like to do, because I have to get off after this question. If you don't mind, I can answer this question, but I want to circle back to an earlier question, and then I want to just kind of give everybody an overview of what's happened. Would that be okay?
Yeah, that's fine.
Okay.
Thanks.
One of the things that you have to certify when you're doing the loan application is current economic uncertainty makes this loan request necessary to support the ongoing operations of the applicant. So legally, if the business can't support itself, then my answer from a legal perspective, at least my interpretation of it, I'm not a lawyer, is that you could, just because you happen to have money socked away in an account somewhere, doesn't mean that you have to loan money to the company or put it in as an owner injection, you know, some type of an owner injection of equity. So if they need the money in order for the business to survive, I think the legal answer is yes. And then the flip side of that is, I think the way that question's asked is they're asking an ethical question. Do you think I should? And I think that's, you know, they got to get on their hands and knees and pray about the answer for that one. The one I want to flip back to is, there was a question earlier about, you know, what happens if people try to take advantage of this? One of the other things that you have to certify is that all the information is correct and that you're going to follow the rules that have been laid out. You heard someone from Christine earlier. And if you do not, there's two different penalty levels depending on, I guess, the level of the misinformation. You got the first one is only 5 years and $250,000 fine, and 5 years in prison. And then the one, if you really do a bad job and I guess you really break the rules, you're in for 30 years, up to 30 years, and you can be fined more than up to $1 million. And, you know, when you fill this form out, you're signing that. And that was something we talked about earlier. The thing I wanted to mention is that I've talked to 5 lenders that are all in the top 20 SBA lenders in the United States within the last 24 hours. And while I was on this webinar, I've gotten a couple emails back. The majority of the lenders, or all of them actually at this point, are going to take care of their own. Very few saying that they're going to take applications for the PPP loan from outside people. We've got one company that's been willing to do it, And David, since you and I talked last night, the rules regarding fees that any agents can charge. And agents are described as just about anybody with 2 eyes and a nose, accountants, lawyers, people in my position that are technically brokers or agents, cannot charge a fee at all. It does say that the lenders can pay a fee out of what they're getting from the SBA, but no one can charge a fee. So if you're a campground owner and your CPA is helping you, you know, I don't think anybody's going to mind there, but if anybody tries to charge anybody fees to put these loans together or to package the loans, basically they're breaking the law. And the lenders are saying they have limited resources and they're going to make sure that their borrowers get the 6-month deferral and they get the PPP loan, and they're not going to think about anything else. So the advice to every campground owner that's on this call, or anybody that listens to the tape, you know, the YouTube video later on, go to your bank. You go.
So what would you recommend though, Paul? We've heard from some campgrounds that they've gone to their bank and their bank isn't participating as a lender. So what would you recommend in those situations?
Well, if you want, I can, I don't know, you and I can talk about this later, but there is one lender that we use that's got an online portal. They're one of the national lenders. I think they're #2 in the United States for dollars. You know, I looked at a report online. So they're a tech company, and they're willing to take money. I mean, excuse me, they're willing to do the PP loan with anybody. It's an online portal. There's, again, what I can do through ARVC, I think would probably be the most appropriate thing, is we offer the loan portal to people that can't go to their local bank. And again, there's no cost to it. It's just an online registration. I registered, the portal's up. I registered a couple days ago, but until it becomes active on Friday, nobody's going to contact me.
Okay, so yeah, after this call, let's get that link up on the information hub so that campgrounds can use that as a resource if they need it. Thanks, Paul. And I know you have to jump off, so I'll follow up with you with any other loan questions, and we'll get those posted like we've been doing. Thanks for joining us. Appreciate it.
Do we get to talk for an hour tonight too?
Well, only if we're lucky, right? Thanks, Paul. Appreciate it.
You're welcome. Bye-bye.
Okay, so this next question, I'm going to jump back to kind of a cross between emergency management for you, Patrick, and mental health for you, Jenna. The first question is mental health, I think, more than anything. Should we check up on campers in a few weeks to see how they're feeling? And what kind of recommendations do you have on that front in terms of communicating with campers? And then for Patrick, your side of the question is, if they weren't ill when they arrived, but start having symptoms and don't let us know without us, going door to door, are there any recommendations on how to approach that as well? But before you answer, let's jump back to Jenna on the mental health side of it. What advice do you have, Jenna?
So, I mean, absolutely. I think it's important that they are checking in with their campers just to see how they're doing and kind of get a pulse on, the overall feel, which obviously is very challenging to do given our social distancing right now. And I don't know, I think maybe getting creative with how to do a check-in. But there's got to be some way to just, see how people are doing.
This might could be a question to the marketing guys too. Is there a social media way to do it? Maybe, I don't know. You're talking about getting creative with it. Maybe that's one way.
Can I jump in for a second? This is Irene.
Sure.
From a risk management standpoint, with communication, one of the things that, I'm creating some different resources on this, and one of the things I'm recommending to people with the check-ins is when they check into the campground, to establish a way to communicate with them, get their cell phone number, and then also, find out if you can FaceTime with them or Skype. And then just like instead of having someone who walks around and kind of stops at the sites in the evening, hey, how you doing? How's the family enjoying the park? Let them know we're gonna do FaceTime check-ins if we can, and and if you can't do it that way, we'll give you a call. But because we wish we could stop by and visit with you, but we can't. So this is what we're doing, and it's personal one-on-one. And you could also assign someone who works for you who shouldn't have interaction, like from a vulnerable population, whether they're older or maybe have some type of immune issue where they shouldn't be out interacting with other folks. That can be a way for them to work for you and reach out and do that task. So that's a good reassignment of task too, from a risk management standpoint. And I think a lot of it's very simple.
And Irene, I really like that idea. I think it keeps it personal. It lets the camper know that you care about them and you still want to have some kind of contact with them, but obviously you're being safe about it. But then if someone, David, you asked if someone develops symptoms and then, what do you do about that? I mean, there's obviously a lot of issues that go into that. Is there, and I don't know if this would be allowed, is there something that you could say when a camper enters the site saying, if you do just start to develop any sort of symptoms and you're not feeling well, you need to let us know so that we can be there to help you, support you? I mean, I don't know.
I want to jump in on the tech side. So Heather and Travis from Campers app, they have released a new demo that utilizes their augmented experience within the Campers app. And they have a demonstration where one of their parks created an introductory video. And so as a guest pulls up, they can actually hold up the phone with the Campers app and see an augmented video of those owners talking to them as if they were standing there. So that's kind of a neat tech way of creating some sort of engagement utilizing technology. And that's through the Campers app that Heather and Travis launched this week.
That's a cool idea. Do campgrounds have to be members of Campers, and not members of Campers app, but you know what I mean? Do they have to be already doing business with Campers app, or is it open to anybody?
I don't know. I'm sure if Heather's on this, she'll be pinging me right now, like screaming at me to say something right. So I don't want to put my foot in the mouth. I do know that they're being very flexible on this. Yeah. So I would say reach out to them to find out more.
David, this is Jeff Sims. Can I jump in on an issue right quick?
Hey, sure, Jeff. Thanks for hopping on.
Well, I apologize that I'm coming in midstream, but I'd like to go back to the question about if your guests start exhibiting symptoms. And I would tell all parks, contact your local Department of Health immediately.
Yeah, we that actually came up earlier in the webinar too before you hopped on, and
yeah, so I apologize, but when I heard that, yeah, okay, I'll mute myself.
No, you're fine. You're fine. Thanks for hopping on. Okay, so it looks like a majority of the questions that we have left are either loan related or legal of some in some way. So before we wrap up a little bit, I want to, like I did last time, just open it up to the panelists for some open discussion on topics that you're hearing when you talk to clients of yours and are out there on social media, things that we maybe haven't covered today that you think are worth mentioning.
This is Chris Hipple from Leavitt.
Hey, Chris.
One thing that I would mention is that, we insure a lot of campgrounds and probably only 10% of them have workers' compensation with us. The campgrounds historically, I'll have this conversation 100 times a year where they're saying, oh, they're 1099 independent contractors, things like that. Well, it sounds like in order for them to get payroll included, they're going to have to be, paying actual payroll and things. Remember, if you do that, if you're switching people, how you're paying them, you're going to want to probably get workers' compensation. So, and that's where it's going to get coverage if they get sick too. So that's
a
the
good
only thing I have
point.
to say.
Yeah. Anything else from our panel of experts?
This is Mark. So as we look at where we're at right now, it's April 2nd. The jobs report just came out. There was 6.6 million unemployment filings, and it's additional 3 million in the last week. And as we look ahead over the next month, this is supposed to go on for another 4 or 5 weeks of this shutdown. Up until now, I've held off on saying anything about pricing and creative structures, but it's now seriously time to start thinking about how you can get creative with pricing and promotions. Now is not the time to promote, but once this time comes to an end, that will be an opportunity to promote. But one of the big things that's going to happen here is, we've enjoyed this massive run up in enjoyment in RV parks and campgrounds. At the end of this month, we don't know where the consumer is going to be at. We can start guessing, but it's still too early. But just be ready and start adjusting and knowing your financials, that can you operate at a 30% rate reduction from where you were this last season? If you can't, what can you do to be creative to get people in your park? I have a feeling that that's going to be necessary this season to get people back into your places. You're going to have to be creative with pricing.
Yeah, and I'll add to that as well that, going on the assumption that after people are cooped up in their homes for as long as we all have been, when we have the opportunity to get back outside, I think we're going to see a big uptick in people wanting to go camping and RVing, and I'm not alone in that assumption. ARVC is already in partnership with RVIA, Outdoor Recreation Roundtable, which we're a member of, which makes all of you a member of. We're already having those conversations around how are we going to be marketing to the consumer to get them out to your campgrounds after this is lifted. And some of those ways are obviously going to be through the Go RVing website, which uses Go Camping America directory, and we're in the process of redesigning that Go Camping America directory and launching an app and all sorts of things that will help in that marketing effort once we're able to start. As Mark said, now's not the time to do that. Now's the time to focus on your business and making sure that the campers that you have currently are safe and that you're following all the CDC guidelines and those things. But once we will get to that point, and once we do, we're going to be set up as an industry, I think, in a good way to be communicating with those campers out there who want to get outside and enjoy the outdoors in your campground. Anything else from any of the other panelists before we
now's
wrap
the
up?
time to start planning that, David, though. Like, think about what your strategy is going to be when it happens. I think there's going to be a bigger shift toward people who are local, staying local versus being willing to travel across the country, because it's going to be tentative at first. We are actually having our graphic design team put together a whole series of story ad format, like digital things that I'll make available for free on your blog when we have it ready and the time comes to actually deploy it, to encourage people to camp local. So we're going to have a bunch of graphics that we'll make available for social media and stuff around a whole common theme that anybody can use. We'll just use some camping stock on it and stuff like that. But so owners who aren't even tech savvy can just take this quickly and deploy it and hopefully be ready to hit the ground running when the time comes to do that. But in the meantime, it's reputation, David. That's what we keep hearing. We keep hearing these stories of people who are getting crazy comments and Facebook social media posts that are taking off. I had a park who called me last night who, in their seasonal group on Facebook that they couldn't find and we couldn't access, it took us 7 hours to figure out where it was coming from. They were spreading around this rumor that they had taken in 6 families from New York, and the park was going to shut down because it was under quarantine because of those 6 families. Didn't exist. There's no families from New York in the park at all, but it ended up causing the county sheriff to show up at their park and ask if they had 6 families from New York.
And that's where that reputation management tool that's up on our website that you put together comes in handy, right? I mean,
in a lot of ways,
them.
yes. This is a rare
Yeah.
instance where it wouldn't have because it was in a private seasonal group. But yes, I mean, just the more you can pay attention to, the better.
Yeah.
And I will tell you that I just got off of a conference call, and every time I hear this rumor has it, scares me to death, because you need to thoroughly vet. And in fact, while we were on that call, I was able to vet the information as incorrect. And so you want to clearly do that. And Brian, to think that the sheriff's department showed up, we had one show up at a member today and tell them they had to close down by orders of the state patrol. And so even the sheriff's department was dealing in rumors, and it was incorrect, and we got it resolved. So just be thoroughly vet information that you are listening to or putting out.
Don't rely on social media. I think Jeff, would you agree that the best way to do that is reach out to your state association, find out what's going on in the state, reach out to you, find out what's going on, that kind of thing?
Oh, absolutely. And we're trying to provide as much information, but we thoroughly vet it. One this morning, I went through several health orders and executive orders to determine what the real truth was. And I do apologize for some that I normally respond immediately. But like I told them yesterday, I've got 10 fingers and there's 12 holes in the dam, and I look at which one's leaking the worst at the moment and try to plug it. So we will keep working at helping everybody get the answers that you need.
Understandable. Patrick, any updates, campground specific updates to the Disaster Hawk app, or anything you want to share on that?
Yes, well, a couple things. One of which is for those of you who have Spanish-speaking employees, we have the disaster plan, the portion that is meant specifically for employees. We had that entirely translated into Spanish. We also have, for families who are in the park themselves, we actually have a disaster plan that is entirely in Spanish. We have other languages going up next week. We have French and a couple of other languages too, so that's really cool. I also got a lot of feedback from you guys, so thank you very much. We got a lot of feedback both in the app and also through emails. So we have changed a few things. We've added stuff on dog parks. We've added things about boat launches and kayaking and all kinds of stuff and activities. The stuff on sanitation, we also updated a lot of that stuff, and in fact, we're probably going to create a separate plan within the app specific for sanitation for a lot of you guys, because you guys have some really wonderful questions, and that really helped us to improve it. So we thank you very much for that. So the app's being improved, and then next week we'll have some brand new updates also. We have a few exciting things going up as well. One thing I did want to mention to you folks, and this is something that is less an emergency management issue, but it's more of a customer service level. And I do this because I run a disaster company. So I wanted to let you guys know. One of the things that came out a couple of days ago was from Nielsen Marketing. They were talking, and I was talking to the Alcoholic Beverages Council. The amount of alcohol sales has spiked 55% from year on year, and that's only increasing. And I want you guys to know that you guys should be doing and making sure that you are doing some additional training for your customer service staff, because nerves are frayed. People are starting to get stir crazy. People are getting tired of being around their kids all the time, that there's no release. So one of the things that, even though you may have your normal customer service training that you're doing because the season may end up being delayed, you need to make sure that everybody has an idea about how things may be different, how to deal with people in the park who may become belligerent, people who may become, who may be just kind of harried from everything that's going on. As a disaster company, the reason why it's important is because we get calls all the time from business owners asking us about various things. And so we're just starting to notice an uptick in that tempers are getting short. So one of the things to make sure that you do is sit down with customer service staff and say, if you're talking to a guest who maybe is belligerent, and this also kind of plays into mental health, because there are people who are going to be anxious, nervous, maybe even strangely enough, they're going to be depressed. And you have to know how to deal with all those folks, because it isn't just simply saying, hey, you know, here's a phone number, go ahead and call if you're depressed. You have to be really engaged so that they feel like you're committed to them. So those are just kind of, it's just kind of the overall zeitgeist of what's going on. People are going to be traumatized. Obviously, people who may already have substance abuse issues, that's going to increase dramatically. So just kind of keep that in mind as you work day to day, as you deal with these customer interactions. Just kind of keep in mind that people are going to behave very differently. Even people you may already know and have had in your park before, they're going to behave very differently than they normally would. So I just kind of wanted to add that, less as an emergency preparedness professional, but more as a business owner. So that was my perspective.
And like you said, that has a lot of connection with the mental health topic as well. And I think Jenna had to hop off, but I will connect with her after this, and we'll try to get some resources up on the website in terms of how to handle those types of situations as well.
David, I'll send you this link. I literally just got in my email 10 seconds ago from LinkedIn Learning, who has released 6 mental health courses for free on their LinkedIn Learning platform. So they've got mindfulness practices, the mindful workday, meditations for work and life, managing stress for positive change, how to manage feeling overwhelmed, and balancing work and life.
Excellent. Yeah, and those are probably courses that they had prior to COVID-19, but
no, they're new. They're brand new. Yeah, they're supposedly brand new.
Okay,
yep.
Even better. Yeah, share those with me, and I'll get them up on the resource page. All right, so we've reached our time. So just to close this out, I want to give a few reminders to everyone. We'll be back on this same channel again on Monday at 11 a.m. Eastern. You can use the same link to join as well. And like I said at the start of the webinar, if you have questions between now and then, feel free to email us at membership@arvic.org, and we'll try to get those answered between now and then. If not, we'll get them answered on Monday's webinar. All the webinars are recorded and posted, like I mentioned, for you to reference later on arvic.org/coronavirus. We've talked a lot about resources on this webinar that we will get posted in the next day up there as well. And I want to, again, thank all of our panelists for joining us today and sharing their knowledge with us, and thank you to all the participants as well. And I just want to close by saying, remember, we're all in this together. So if you have any needs at all, don't hesitate to reach out to ARVC or your state association for help. You can reach us anytime. Our contact information is on our website. And thanks again. We'll be back here on Monday at 11 a.m. Eastern. Be safe and be well.
Thank you.